welcome back to another episode of the Healing With It podcast. This week I'm super excited. I have one of my best friends, Anika, here with me. And today we're going to talk about music therapy because she is a music therapist and she does some amazing work for everyone in the community. And I'm excited for you guys to hear what music therapy is, learn all about it, and how it applies to mental health and mental wellness. But before we get started, we have to do the mindful moment of the week. So this week, my mindful moment was feeling like, or noticing, I guess, when things were a little bit stressful and busy. I've kind of been in between my home and in Toronto, and things have just been back and forth. I feel like I haven't had a lot of time between clinic and just daily life to take time for myself. So noticing on Wednesday when I had some plans to go out with friends that it was okay for me to take that break and actually just enjoy myself, and knowing that everything was going to work out, because that's something that I struggle with a lot. So I was able to actually just enjoy myself, and guess what? Everything did work out. So that was really exciting, and I'm really proud of myself for that. And so Anika is going to come and join us today and tell us her mindful moment of the week. So take it away.
So mine's actually pretty similar to that. I've been finding lately on Fridays that I have kind of a problem with letting go of productivity from the week. So yesterday I got done work, kind of cleaned the house, and felt very anxious that I still kind of needed to be doing something. And then I kind of just took a step back and realized what I needed in that moment wasn't to be cleaning more things. It was actually to be taking a nap. So I made the executive decision yesterday to take a nap, and I was very proud of myself for it.
I'm proud of you for taking that nap.
Thank you.
Naps are honestly so necessary. I feel like there's something that, as an anxious person, I feel like it's so easy to be like, no, I should be doing something else. And trying to nap, you're just thinking about all the things that you should be doing. So I completely understand that, and I think that was really mindful of you.
Thank you.
So without further ado, we're going to dive right into this episode. I'm super, super excited for you guys to learn about this topic, because I feel like not that many people really know about the music therapy area, and I think it would be really great for more people to discover it and see how it can really play into mental health and mental wellness and just general health and the healthcare industry. So I'm going to have Anika introduce herself and kind of talk about like what music therapy is and what she does on a day-to-day basis in her career in music therapy.
So my name is Anika, as Kirsten was saying. I am an accredited music therapist. So in my day job, I work with individuals with dementia, and I work in memory care, and I also work with individuals with exceptional needs. Kind of what music therapy is, it's not something that you hear about very often, especially in the healthcare space. Music therapy is basically the use of music as a tool to accomplish either sometimes musical goals for the individual, but primarily non-musical goals. So for instance, if somebody was feeling a lot of anxiety, you might have that goal of reducing anxiety for that person. So music therapists may work in like a variety of different areas across the board. I primarily work in long-term care, and I work with individuals in long-term care, but sometimes music therapists will work outside of hospital settings, maybe in classroom settings. I know they've done a lot of studies in the States on music therapy in correctional facilities, as well as music therapy kind of pretty much anywhere you can think. Music therapy can be in hospice care, palliative care, end-of-life care, as well as just kind of in the community as well too. There's a lot of private contractors who, again, anytime there's kind of a goal, you can use music as a tool to potentially accomplish that goal. In terms of training and qualifications, music therapists, generally we do an undergrad degree in music or music therapy, at least in Canada and Ontario where I live. And we complete an 1,000-hour internship at the end of our university time, and we get that kind of in-person experience in working in healthcare.
It's such an interesting industry, I feel like. And like I was saying, I feel like people maybe when they hear music therapy don't realize how much work it actually takes to get into it and be like an accredited professional in this area. It's not something that you can just take a quick course on to actually give the full experience and have the knowledge that you really need in music therapy. Like, it takes a lot of work. And like, I watched Anika go through her undergrad and her master's degree in music therapy, and I saw how much time and dedication it really took for her to do it. So it's something that takes a lot of work and a lot of knowledge, because again, it is a form of therapy, and that takes a lot of like knowing different aspects of health and the human mind and how people interact with music. What I thought was really interesting is the point of you saying how you'll use music as a way or a therapy for something that doesn't really actually tie into music necessarily. Like, it's not musical, but it's like something therapeutic in a different sense. I would love if you could maybe go into that a little bit more, like what that looks like in a person. I know that you're typically working with more of like the geriatric population. So like, what does that look like for an interaction with somebody?
Sure. I'm going to go kind of off of the question and then come back to it.
Go for it.
So to give everybody a kind of better understanding of what music therapy might look like, a lot of us are very kind of comfortable with seeing musicians working in performance settings. And a lot of the times, like somebody who is a music performer or an entertainer might provide like a set list that appeals to a larger group of people with the general goal of people enjoying that or making people happy or bringing happiness or some sort of enjoyment out of music. Whereas the kind of difference between music therapy, which gets confused a lot, is that a music therapist might create goals and assessment and evaluation criteria, and that music might change and adapt in the moment to meet the needs of the group. So if somebody becomes frustrated and starts banging on a drum, for instance, you might change that music in order to follow them in their process rather than kind of a set list at like a concert or something. The way that I always kind of explain it as well too, if you think of a physical therapist, so somebody can show you an exercise and it might benefit you physically, but a physical therapist might have goals and objectives and a care plan behind those exercises that work towards an established goal and treatment plan. So it's kind of the same with music therapy, that we can use music for enjoyment, but again, we use that music as a tool in order to accomplish a goal. So in my job, I can only kind of speak to my job right now, but in my job specifically, I might use music to match somebody's anxious feelings. So using music to kind of play faster and then slowly get slower in order to kind of calm the individual down. Or we might use music as a tool for communication. The cool thing about music is you don't necessarily need to be able to communicate with speech in order to engage with it. So sometimes you can communicate with somebody's preferred song. Like if you think back, maybe your favorite song is, I don't know, what's one of your favorite songs?
Let's say Post Malone.
Post Malone. So Kirsten and I are listening to Post Malone, and if I were to bring that to her, we might find that connection and build that relationship because I'm bringing something that you prefer and something that's meaningful to you.
Okay.
So in my day job, again, I might work with groups and we might have a goal for like social interaction between people or kind of cognitive stimulation or sensory stimulation, or I might work individually with people, just kind of depending on the need. So yeah.
So one thing that I did find really interesting that you said all of it was interesting, obviously, but one particular point that I caught on to is, I guess you were saying, or what I kind of understood from it, is that music therapy is kind of very adaptive when it's with somebody.
Yes.
So like something that's changing to match the energy of someone, so it might start somewhere and end somewhere completely different. Is that kind of correct?
I think adaptive is a very good way to describe it, and something that we try to do is we try to work from a strengths-based practice. Okay. So using somebody's resources and using somebody's strengths to inform that. So not focusing on what you can't do with an instrument or whether or not you can or can't sing. So focusing more on empowerment and focusing on what people can do and how you can change what you use as communication. So in my case, that would be music, in order to meet the needs of that very moment.
Okay. So in your particular setting, working in a nursing home type setting, what does that look like? Like, is that you playing music or using instruments for the residents or a particular person? Or is it kind of a mix between you and the resident also using some form of music and or instrument?
Exactly. So it's kind of a mix. So a lot of the times, so I have a cart, and I push my cart around and I bring music on unit. So I have a guitar that I primarily play, and I might bring instruments and ask the individuals who are participating whether or not they would like to engage with that instrument. So again, it's choice-based, it's also strengths-based. If somebody were to play an instrument, so for example, maybe a drum, the person's beat that they're playing on the drum, I might match with the guitar and my singing in order to improvise with them. A lot of the times in memory care and dementia care, we use familiar music. So using music that somebody might have loved and appreciated in their early to late teens and 20s, because that's the music that they remember and that speaks to them the same way we remember music from our youth, and it kind of brings you back to that certain experience or that certain place in time.
Yeah, that's really interesting, and I feel like that just goes to show how much talent and how much work goes into music therapy, because again, not only is it the adaptability, but you yourself have to be really adaptable on the spot, which is not an easy thing to do. It's like trying to figure out where that person particularly is at, and being able to sense that in itself is very difficult at times. You have to be really mindful of like the cues of a person, and especially somebody maybe who isn't as verbal or is showing it in nonverbal cues can be really hard to detect, because I think we're so used to like if someone's angry, we think someone's yelling, or if somebody's sad, they're crying, but that's not always the case. A lot of times there are these nonverbal cues that humans show, whether that's hand signals, where the eyes are looking. There's so many different ways that you have to be able to sense that, and to do that in a moment in itself must be really difficult on the job, to see where somebody is at and how they're feeling without them even using words at times.
Something that I find is very interesting, and I think you're right on the money with it there, something that's very interesting that I learned going through school for music was that music therapy a lot of the times is about listening just as much as it is about creating music with somebody. So really listening to that person and paying attention to like their body language as well too really makes a difference. And you're right, like there are those cues that we all give as well too. Like if you sometimes aren't interested in a conversation, you might turn around the other way, or if you're really excited about something, you might get close to somebody. So it's really about kind of that active listening or active attention to the individual.
Yeah, and active listening is really difficult to do at times, because I feel like, and I'm probably one of the worst people at this, I'm really trying to get better at it, is trying not to say something when someone is speaking or when someone is showing these cues or saying words, and how you can just let them express themselves while listening and paying attention and not just thinking about what you're going to say next and what you want to say. It's a really difficult thing to do.
Yeah, like not formulating your next answer in order to answer, but actually listening to what the person has to say.
Yeah.
I think something too that we've become accustomed to is we fear space as well too, or we fear silence.
Yeah.
So like learning to listen and leaving those silences, which I know I'm a hypocrite. Like I'm bad at it as well too. It's terrifying when you hear those silences or you're in a conversation and somebody doesn't immediately respond to you. Mm-hmm. Leaving those spaces to let yourself process and think, as well as the other person as well too, mm-hmm. and leaving those spaces so that you can hear the other person.
I think silence, like you were saying, is such a difficult thing for us. It is so uncomfortable, and we do want to just like move on to the next thing, but silence is so important because that's the time, like you said, where we're processing things, and where a lot of times people take that step back and figure out what they want to say, how they want to respond. And I think that we could all take a lot away from that, because typically when we say things that we don't really mean, or maybe we don't want to actually make another person feel a certain way, it's often when we need to give those silences and take that moment, which we don't take enough because I feel like it's just so normalized to just like go on to the next thing. So that's really interesting how that kind of ties into like the therapeutic relationship, but also into our day-to-day life as well, mm-hmm. and our everyday interactions, whether that's with somebody that we know well or not at all. I think it's really interesting that that all ties in, and really that is kind of what therapy is. It's like how we interact and how we respond and how we can kind of move through the motions of the day using those skills that we learn in the therapeutic area, whether that's with music therapy, seeing a therapist, a counselor, or whatever it might be. That all kind of comes into play, but it's just using it and modifying it in different ways in that setting. Mm-hmm. We've kind of spoken about where you typically do your music therapy, which is in the geriatric setting, but there's obviously other places that music therapy is prevalent in today's society. So where are some other common or more typical places that you see music therapy using, or where you've seen some of your colleagues go and work in?
For sure. So music therapy has kind of a lot of different areas of applicability. Somewhere that I did some work during my undergrad and my master's as well too. I worked and got some experience in internships in hospice care. A lot of people I think that hospice care and palliative care would be a very sad place to work, mm-hmm. but there's a lot of beauty as well too. A lot of music therapists work with, again, that preferred music and telling people's life stories as well as their legacy works, using songs that are meaningful to people as something to leave for their loved ones, as well as songwriting is a big thing in music therapy, especially in end-of-life care. So you might engage with that person through writing a song, which can be a really good way for somebody to express themselves. Music therapists might work specifically in mental health, again with that self-expression tool through music therapy. So sometimes we might work with song sharing or improvisation together. Music therapists might work in school settings, working with individuals who have exceptional needs, as well as music therapy can be used in hospital settings, in all kind of different areas, such as stroke and rehabilitation. There's a lot of neurological music therapy that is done in stroke recovery, mm-hmm. with Parkinson's, things like that. So we're kind of everywhere you look, walking around with our carts and our guitars. There's probably many that I'm leaving out, but there's lots of different ways to include music and use music as a tool for therapy.
So there's a lot of different settings that you would see music therapists in that maybe like we don't typically know about, but it's quite obvious from speaking with you that it's prevalent in a lot of areas, and it's beneficial in almost like every area of life. We can really use it in different settings and in different populations, and in some way it can be, again, adapted to suit that type of population and those people and what their needs are, because it is such an adaptable kind of form of therapy, and it really works with where the person is at, meeting them where they're at, and finding kind of where they are and how you can match that. So that's really interesting because, again, I feel like more people just need to learn about this and how it can be beneficial. I think it would be really cool to start seeing more and more programs pop up with music therapy and just people learning about it in general, because I think there's just this idea that therapy just has to be sitting in a room with somebody, and that's not always the case, and that's not always what works for someone. And a lot of times I think that's what stops people from going to get some form of therapy or getting that help, which we could all use in some area of our life most likely. So I think that it's really interesting because we don't always have to be sitting in a room with someone. While that can be very beneficial for a lot of people, one, it's not always accessible, and two, it's not always what somebody needs, especially in different populations. So I think that's really, really cool to see all the areas that this can really be applied to and how we can start seeing it more and more. Because it is such a really interesting profession and program, and it does take so much time and dedication for you to do.
I think traditionally, like, our healthcare system has viewed kind of these kind of therapies as alternative therapies, whereas, and I know especially with naturopathic medicine as well too, because we've had separate conversations about this, that a lot of the times it's not a separate entity, like you are working together as an allied health team to work towards supporting that person. So maybe if something isn't working for somebody, it's not about eliminating the other form of healthcare, it's about working together to see if you can supplement in order to work together to provide that level of care for somebody.
That's really well put, and I think that's such a really good point. Like you said, it does tie into like what I'm doing in school and like what I'm going to be doing as a profession. I think that healthcare in general does need to change its views and its perspectives and just the way it works in general, because it is so important to have that integrative approach, like coming from one angle and another angle instead of just one, because I think that's where we're going to see most benefit and see a lot of change in the healthcare area. It shouldn't just be this or that or so black and white. It's really adapting to what the person specifically needs and how we can have support on this end, but also support on that end. And it's not like a competition between healthcare professions. It is really like working together, because how can we help this patient or this person the best way possible? Like, what is going to benefit them the most? It's not just going to be, okay, well, this is the best method. It's very individual, and we can really see that.
Like circle of care.
Yeah, exactly. Yeah. That's a really good way of putting it. There has to be that circle of care. It's the same thing in mental health. It's the same thing in just physical well-being. I think different angles is where we're really going to see people have the most benefit and feel their best selves when we can take all these different angles and different approaches.
I know this is a little bit more of a tangent, but in like a therapeutic space, we also need to be able to tailor healthcare to the individual. For example, like outward talk therapy. You might not be in the space where you're able to talk about it. So sometimes bringing other types of therapies, I'll use the example of music therapy because it's what I know, but sometimes choosing music that expresses what you might be feeling and showing that song to a therapist is a little bit less outward than having to talk about an isolated incident or having to kind of dive deeper. In a way, like music, and I know it sounds kind of corny to say this, but music can kind of be a safe space where people can express themselves. For instance, like in songwriting, you might be having some frustrations, and jotting down what you're feeling, putting that into music, it can be just as expressive as telling that to somebody, or even like the melody of music. Everybody has their own preferred music, and it changes depending on the person. So everybody finds their own comfort in their own music. So you might listen to hard rock and that calms you. You might listen to Post Malone and that might make you very, very frustrated or anxious or something. Like, music affects everybody differently, and we really use it, even sometimes without knowing it, to kind of maybe match what we're feeling in that moment. And the example I kind of use for this is like, have you ever been in the car listening to the radio and something like listening to the music, you just have to turn it off. Like it's either annoying you or it's not matching where you're at right now. Definitely. Or sometimes you might get into the car after a really long day, which I've definitely done. You turn on the saddest music possible and you just give yourself a good cry. Like it's just cathartic, and sometimes it's just where we are. Again, as we were saying before, like, we use music to meet ourselves where we are, and we use it as a way to express ourselves, even if it's just us identifying with what the words are saying, or with how slow or fast the music is.
And that really ties in, I guess, because obviously this is a mental health podcast, but what we've been talking about, first of all, really all ties into mental health. Mental health is not one thing or the other. In every aspect, it is addressing someone's mental health. But specifically looking at music therapy in the mental health setting, what does that look like? I know that's not necessarily like your area, but from your knowledge in the area, how is that approached?
I'm probably not the most knowledgeable person, to be completely honest with you,
That's okay.
To be able to describe that. But what I can kind of bring here today is we talk a lot in kind of mental health space, or on social media, in therapy, about mindfulness. And it's kind of a buzzword, but it's something that's really important, I think, as we go along in society, that we be mindful of everything in our daily lives, first of all. But in the music space, music mindfulness is having that attention to what you listen to and how that affects you, or what you take out of that. So something that you might do, everybody listening to this, you're very welcome to try this at home. You might use like a music journal. So every time you are listening to the radio or you put on Spotify, identify which song you're listening to, your mood before listening to it, and then what your mood is afterwards, and checking in with yourself in that moment and saying, like, what do I need? Like, what has listening to this song or listening to this music, what has that given me that I'm able to go from being happy to sad, or vice versa, or something? Like, what do I need going from there? And it's interesting too, that you were telling me this morning when we were going to do the moment of mindfulness, it's really stopping and leaving ourselves that little bit of silence, or leaving ourselves that little bit of space where we can actually think, we can actually reflect on how what we are doing during the day is reflecting us, and reflecting on what we need going forward. So that might look like, I am tired, I may need a nap, or I may need a coffee.
Yeah, and that's really cool, because it kind of ties into what you were saying earlier about like listening to certain music in the car when you just need to be sad or something. But mindfulness is something I talk about a lot. It is really, really important, as much as it might be like something that we think we're doing, but I don't know if we're always very mindful about our mindfulness. But like you're saying with that exercise, like that's something you can actually physically do, is being mindful of what specifically makes you feel a certain way. Because I've talked about this in past or previous episodes, is like what we consume really does impact our mood. So things like watching the news, as much as we might not notice it, really might bring us down into a sad or down kind of mood. What we consume really does impact our day-to-day thought process, our perceptions of the world, and it's really important to be mindful of what we're consuming. And when it comes to music, it is important, as much as music, we love to listen to it, and I'm not saying you can't listen to certain genres of music, of course, but being mindful of how it impacts you by using that exercise, and knowing when is the right time. If this is a moment in my life, or maybe I'm having a hard day, should I be listening to this type of music? Is it going to help me? Or if I'm in like a tough mental space for a while, should I be listening to music that really brings me down and makes me feel sad? Or is there music that I know I can listen to that makes me feel a little bit more happy, and use that in a therapeutic sense as well, right? So kind of using that in your day-to-day life, that is really interesting. But I think it's important to be mindful of what we're consuming, and music is something that we listen to probably almost every day, whether we put it on ourselves or hear it,
or you're in the grocery store, or an elevator or something. I think it's also it's worth something to be mindful of what we're not consuming and what we might be avoiding during that day as well too. Like, I know with all forms of media, sometimes you see something and you click out of it, or your heart can't take it that day. Being mindful of that, and that going forward, like, maybe I need to take a step back, maybe I need to assess what my needs are in that situation, and just taking a mental note of what you might be avoiding doing that day. Like, are you avoiding making that email because it's making you anxious? I think mindfulness can be the things that we're doing, but also the things that we aren't doing as well too.
Yeah, it's very much like healthcare is not just paying attention to the things that are present, but also the things that maybe aren't present, or like you said, we're avoiding. What we avoid also says a lot about what impacts us and how we respond to things. So that's a really interesting perspective. So as you can tell, music therapy and music in general as a therapeutic modality can be used in our daily life, whether we are using it in a program, whether it is through like health education and other aspects. It's prevalent and can be used and helpful in so many different ways. This has been a really, really good episode, and I'm really glad that you came on to talk to me about music therapy and talk to all the listeners about it, because I think it is so important that people learn about different healthcare modalities and different things that can be therapeutic and how they can be used. The more we add to our repertoire of healthcare and just self-care in general, I think the better. So, and knowing that there are those options out there and how they can be brought into different settings as a therapeutic modality. So I want to say thank you so much for coming on today, Anika. I really appreciate it and speaking on this topic. I think everyone is really going to love this topic and really going to love this episode. So thank you so much. I appreciate it, and I hope you guys have a lovely day.
Thank you again for listening to me talk.
Bye.
Bye.